more on this, I have a Program Manager, Center for Integrated Health Program, Oluwaseun Abe, to discuss this issue further. Good to have you on TVC News at this time. So first off, what's your assessment now on efforts to contain the spread of the virus, where we have seen in some states like Lagos having to adopt the style of free testing for residents? What are your thoughts on the assessment to contain the spread?
Yeah, so thank you very much. As we have seen, the theme for this year, what is this? Communities make the difference. And of course, it is to show that the efforts of the different communities, that's people who are infected and those who are affected by HIV, efforts of the social networks have paid off in helping us to actually reduce the prevalence of HIV. So for us in Nigeria currently, the prevalence is 1.4%, and for us also in Lagos State, the prevalence is 1.4%. So this goes to show that tremendous efforts have been made, but then because of the low saturation and high unmet need, especially in Lagos State, we need to do more. We need to identify more people and in our communities ensure that 90% of people who are living with HIV in our communities are identified, ensure that 90% of these people are placed on treatment, and of course, ensure that 90% of those who are placed on treatment have what we call viral suppression.
Now, how do we identify those who have HIV, especially where not many are ready to come out to get their self tested?
So that is, thank you very much. So that is part of the message we are passing across. We are using this opportunity to let people know that now it is time for people to come out freely, to come and test. We are using what we call strategic mix approach, ensuring that people now can test themselves. We have HIV self-test kits, and of course, we can test people in the community. And of course, there's also provider-initiated testing and counseling. So using this strategic mix, it is important for everyone to be able to know their HIV status.
And another thing about HIV is stigmatization, which has been an issue for too long now. How do you think this matter should be addressed if we're to talk about no HIV, no carrier of HIV, for instance?
Yeah, so thank you very much. For us to get to zero new infection, actually, stigma needs to be addressed. So, but I'm glad to tell you that across all the facilities that we support here in Lagos and in other different states and in different communities where we also work, stigma has reduced significantly because people now know that when you are HIV positive and you are on drugs, you adhere strictly to your medications, you can actually have undetectable viral load and you may not transmit HIV to any other uninfected persons. Of course, HIV is just like any other chronic infection or chronic disease like diabetes and hypertension. So taking your drugs, remaining on treatments, of course, is also a positive way to ensure that with this, no need of having stigma. So people should be free to come out in our communities to come and assess testing.
All right, Oluwaseun Abe, thank you very much for your insights on TVC News.
Thank you very much for having me.